Hey GPs, I'm Dr. Jared Williams, and if you're going to be a third molar GP, there's a couple essentials that you're going to need in order to take your skills at next level. And I never leave home without them. All right? So if you're going to treat patients and do well so they don't end up like this, you're in for a treat. Let's jump into it. All right. First things first that I always have to have is going to be my Minnesota. Now, Minnesota is a cheek retractor. A lot of doctors, especially GPs, they like to do surgery when they have a mirror. That's the last thing you want to do. I can't tell you how many complications can ensue when you have a mirror. So the number one thing I like to have is going to be a Minnesota. It allows you to retract tissues. It allows you to prevent any other structures from being damaged. And it's just a wonderful tool that you should have. And I never leave home without it. All right. So make sure you have a Minnesota at all times. All right. This is going to be one of my favorite instruments. As a matter of fact, when I travel to different offices here in Houston, one thing I have to have is a 77R. That 77R will literally save me 20 to 30 minutes per tooth. All right. When I say that, per tooth, it's something that I have to have any one of my surgeries. It doesn't matter which one. When I have that tool, the little bend that you see right here allows me to get into areas that I wouldn't be able to, especially those wisdom teeth that are all the way in the back of the mouth. So make sure you always have a 77R. It'll save you time, make you money, and bring a smile to your face.
Are you a GP tired of referring patients out of your practice and losing out on production? Did you know third molar surgery is a $3 billion industry? If you are ready, join the 5-day third molar surgery challenge, which will give you the confidence, knowledge, and skills to remove third molars safely. During this challenge, you'll enhance your surgical speed and gain exclusive access to insider secrets that specialists for years have tried to keep hidden. By learning these techniques, you'll be able to serve more patients, add more skills, and be the go-to doctor in your area. Don't miss this incredible opportunity to boost your skills, increase patient volume, and revolutionize your practice. Enroll now and let's embark on this exhilarating journey together.
Number 3 is going to be a 150 elevator. Now, this is the only elevator that I use for all my extractions. Well, not all of them. Maybe like 95% of them. Yep, that's right. 95% of the time, I'm using this 150 elevator in order to take out any tooth in the mouth. An upper, lower, it doesn't matter. It's a universal elevator for a reason. Now, when you use this elevator correctly, you can literally replace all the other elevators that you have that are taking up space, weight, and the cost of it. So all you really need is a 150, and I never do any extraction without it. The next thing I want to let you know on are my medications, all right? Now, you're probably going to be shocked by the medication I highlight today simply because not many docs hear about it or do they know how to use it. But today I'm going to share with you the number one medication I typically don't leave home without, and that's dexamethasone. Dexamethasone is a steroid that allows me to give my patients so that they don't have significant amount of swellings around the IAN. I'm pretty sure, like, what? Well, yeah, as a concierge dental surgeon going to different offices, I typically am treated like a specialist. All right, so I don't want all those oral surgeons come out there. He's saying he's a specialist. No, I'm not. I'm treated like a specialist because I have a lot of doctors that will ask me to come in their practice and do some pretty challenging cases. But after 10,000 cases, I have gotten accustomed to getting some of the worst of the worst. But it's okay because that's what they pay me to do. And I always have dexamethasone on tap because I want to make sure that if I'm going to disturb any nerves, I want to be able to have access to it so I could place it on the nerve and have the patient, you know what I'm going to say next, smile after surgery. All right. The next thing I want you to also be aware of is this. It's going to be my cotton tip applicator, all right? This is super important to me because what it allows me to do is not place cotton gauze where I need them. No, this is for those roots that are all the way in this socket. And the reason why I use this is because it allows me to grab a root in such a way that I automatically know how much pressure I'm putting on it. Like I stated before, a lot of the cases that I'll have, they'll be pretty challenging and they'll be by the nerve. And this amount of manual dexterity that it allows me to work with allows me to determine how much pressure I'm going to be using when I'm working on cases like these. So if you're not using one of these to take out your roots, put all your rongeurs away and pick up a cotton tip applicator. It'll save you a pain in the tooth, all right? The next thing that I will typically have with me is going to be a surgical handpiece. Now, a lot of docs, they will cut crowns and do root canals and do fillings with a standard handpiece. Now, while you can do surgery with a standard handpiece, I would advise against it. The reason why is this is that you could have air emboli that go into the side and cause the patient to have air emboli in the area, or emphysema in a sense. And when that happens, it's very challenging and painful towards your patients. And the reason what it does is it pushes a bunch of air forcefully into the area that you're working with. Now, when you're doing third molar surgery, you want to have everything being pushed away. And that's why I say a surgical 45-degree angle handpiece. Well, one will push all the air away from the surgical site, and it will allow you to have that bend that will give you access to the teeth and the surgical site that you're working in. So it's a win-win for the surgical site and a win-win for the patient as well. All right. In addition to that surgical handpiece, you want to have a 557 burr. Now, I have a couple of favorites. I'm not being sponsored here, but I will definitely say one of my favorite burrs are going to be a Meisinger 557 surgical length burr or a SSY. Those are going to be my favorite burrs to use when I'm actually working on patients and cutting. I find that it cuts really nicely and those burrs typically won't separate. So keep that in mind when you're taking care of those third molar horizontal impactions. The next one we're going to talk about is going to be gauze. Now, I'm pretty sure you're like, what? Gauze? Yes, gauze. I want to let you know 2 cents could save your patients $10,000. Not your patients, but you $10,000. I use it as a throat pack just to make sure that there aren't any dental instruments, teeth, bone that will go in the back of the throat, causing the patient to choke and gag, or for an instrument to go into their lung. So by just being able to put some gauze in the back of the patient's throat, it's going to be able to save a life. So keep that in mind when you're doing these surgeries, because if you look online and you look at how some of these surgeons are doing their procedures, it's not safe for the patient and for their careers. So keep that in mind.
Are you a GP tired of referring patients out of your practice and losing out on production? Did you know third molar surgery is a $3 billion industry? If you are ready, join the 5-day third molar surgery challenge, which will give you the confidence, knowledge, and skills to remove third molars safely. During this challenge, you'll enhance your surgical speed and gain exclusive access to insider secrets that specialists for years have tried to keep hidden. By learning these techniques, you'll be able to serve more patients, add more skills, and be the go-to doctor in your area. Don't miss this incredible opportunity to boost your skills, increase patient volume, and revolutionize your practice. Enroll now and let's embark on this exhilarating journey together.
Then we're going to highlight our local anesthesia. Now, when I work, I always have 2 syringes on me at all times, and they're always going to be those long needles. And I'll use a bupivacaine, a lidocaine, and a septicaine. The reason why I use the long needles because what you can do with the long, you can't do with the short. All right. So I want you to get in the habit of just using those long needles. There's been research that stated that there is very little change of pain that a patient will actually feel. Well, in order to get around that, what you do is use two needles because after repeated use, the needles will get blunted. And so the reason why we use a long needle is so that we prevent from tearing those tissues. So when we use those two needles, we're typically passing those needles back and forth to the assistant because I use four-handed dentistry, and I'm pretty sure you do. If you don't, you should start. Also, when you're doing local anesthesia, you want to make sure the patients are profoundly numb. So here's a little scenario that I use when I'm working with patients so that you'll never forget. When I use my pivocaine, it's like a shotgun. Pow! It creates a huge outlay of the medication because there's no epinephrine. Because there's no epinephrine, there won't be vasoconstriction of the vessels, so the vessels will just act as normal. Well, when they act as normal, the medication will just waft out into the tissues. Very non-specific. However, when you use lidocaine, it's kind of like a sniper. It hits right in the spot. And if your aim is off, then what's going to end up happening is you're going to end up using a lot of medication on your patients and potentially causing them to have some type of local anesthesia toxicity, which we don't want them to have. So I use the mepivacaine and the lidocaine when I am getting my patients numb so that I literally am able to make sure that they smile after surgery. And then the other one is a Septocaine. It's a little bit stronger than Lido, and I use it as an infiltration basis. Never any blocks like Gauze. All right, so those are ones that I always gotta have. Then my trusty 15 blade. Yes, yes, yes. Gotta have 15 blade when you're doing third molar surgery. The reason why is you want to create those flaps for your surgeries. Now, the only two flaps that I use will either be a triangle or a trapezoid. Triangle or trapezoid. Triangle or trapezoid. All right. And so typically when I'm doing my triangular flaps, it's going to be around teeth that are completely soft tissue impacted, which means no part of the crown is seen. The time when I use a trapezoidal flap is when the tooth is actually present, and it works really nicely. Now, a key here in order for you to do any flap well is just make sure your base is wider than your apex. All right. So just make sure that tip of your triangle is smaller than the base, and then you're going to end up doing well with any flap that you create. So get that 15 blade out and make sure it's super duper sharp so that you and your patients can have a wonderful time during surgery. All right. Last but not least, number 10. Now, this is the last medication I use, and I'm pretty sure you're like, I already know what it is. I guarantee you won't know what it is. And if you know what it is, drop it in the chat. Let me know that you actually figured it out. But I'm pretty sure you're like, all right, if he does third molar surgery, I already know what medication he's going to say next. Well, I could let you know. I could guarantee you don't. But like I said, if you really think you know and know how I practice, throw it down in the chat. All right, throw it down in the chat. I'd love to go back and forth with you. Now, the medication that I use for 100% of my patients is going to be topical. You're like, what? Topical? Yes, topical. You know, the little jelly that you place on the patient's cheek and you immediately go back and get the patient numb immediately? Yes, that one. Yes, the reason why I like to use topical is because what it allows me to do is present the patient in the most comfortable scenario possible. Now, we know topical is not going to get the patient profoundly numb, but what it does is it starts the process off in your favor. Now, I want to share with you how to apply topical because a lot of docs have no clue how to do so, even to the point that I didn't know until I went to residency. And you're like, what? You went to residency to place topical? No. But during my time in residency, we had a periodontist that was present, and he showed us different surgeries. And one tip that he always gave us was, number one, get the gauze, pull the patient's cheek forward, wipe the area till it's nice and dry. Get a small amount of topical, place it in the area, and cover it so it stays nice and dry in this area that you want to place it. And leave it there for 60 seconds. Now, it may sound like, well, duh, but I can tell you as a concierge general surgeon, as I go to so many different offices and I see how GPs and specialists will treat their patients. And if we're going to understand that patients are the lifeblood of our practice, we have to be cognizant of that at all times. And any benefit, any tip or hack that we could do to make sure that our patients are comfortable, it's going to be beneficial all the way around. So if you are a doc who is just like, I don't care about topical, let me go ahead, then sure. But for all you other GPs that are out there, and even specialists, because I know you're watching, what I want for you to do is this. I want you to just dry the tissues off, put the topical down, leave it there for 1 minute, let it work, and then get the patient numb. And that's how you're going to have the patient smile at surgery. All right, guys, so there you have it. That is my top 10 things that I use for all my patients. Now, these are essentials. If I'm not having any one of these for any one of my cases, I'm almost certain my surgeries are going to add at least 30 to 45 minutes on top of the time that I automatically take. And I'm pretty quick. But if you are wanting to be a third molar GP, what I want for you to do is this: like and subscribe to this channel so you get more tips so that you and your patients can smile after surgery. All right, docs, I'm Dr. Jared Williams, your third molar expert. Make it a great one.